checking my patient's chart. It's Mrs. Livingston's chart for new orders, and I see here that I need to put a Foley catheter in here because the doctor that did her surgery wants accurate I&O kept on her. I'm also looking at my patient's chart to make sure she doesn't have latex allergies or any reason why she can't get this Foley catheter. Good morning, Mrs. Livingston. How are you doing today? Can you tell me your name? Let's see your armband. Ruth Livingston. 10854. All right. Today we're going to put a catheter in you because the doctor wants to keep accurate eyes and nose, meaning he wants to see how much urine you're putting out. Because he wants to keep extra close track of your fluid status. It'll probably just stay in there for today, maybe today and tomorrow. We don't want to leave catheters in very long because they're a good source of infection if we don't take very good care of them. Okay? Do you have any allergies? No? Do you have any problems laying flat in the bed with your legs up? No? What I'm going to do first is I'm going to wash you. Pericare, as we call it, but I'm just going to wash your bottom so we can make sure it's nice and clean down there. Because like I said, catheters can be a source of infection if we don't take good care of them. So that's what I'm here to do. Some soap and water here. Of course, for pericare, you would use soap and water. The hand sanitizer is not an acceptable form of pericare. I'm going to raise your bed. I'm going to raise your bed. Have you been having any trouble voiding or peeing? Having trouble getting to the bathroom in time? Well, this will help that as well. We'll keep you covered as much as I possibly can. And we're going to just wash down here. While I'm washing down here, that's a good time to locate the urinary meatus, because sometimes on your female patients it's not that easy to find. So another good idea is to have an assistant come with you that has a flashlight or some kind of light to shine down here. So that's a good job for a CNA if you have one, or anybody else that will help you. I want to dry this area good. You can cover her back up for a minute. And this, of course, goes in the dirty clothes. Wash your hands. Take this. Catheter kit. Once again, we're going to position our patient in the dorsal recumbent position. Bend their knees up, if possible. I put her bed a little bit too high. Her legs. Put her bed a little bit too high. Put that down. Put her knees down. Good enough. This is the dorsal recumbent position. See if they can abduct their hips if they're able. This makes a very good field for you. This can get out of the way. And cover this much up if you can. Keep as much covered as possible. We're going to work on opening our catheter kit. This is waterproof plastic. The package that your catheter kit comes in. It's not garbage. It's to be used for your garbage when you're getting ready to put your catheter in. So cuff the bag and keep it right here handy. So what we're working on doing right now is setting up a sterile field. So you want to open this one first because all this is covered up. Which bag's got to get out of the way? You open this flap. This flap. You remember the 1-inch rule. And then this flap. And depending on what's on top of your sterile field, or in your package rather, so this is going to go under your patient. This is the waterproof drape. So 1 inch, you can touch around the sides. Pinch. Well, pinch the first one. Never did get my thumb in there. And cuff the second one. There we go. Now my hands are sterile. I know this is a little bit lower than it needs to be, so apply your fenestrated drape. And what this does is gives you a sterile field. Okay, this is sterile, so you know everything in this whole area is going to be sterile. So all this is sterile. So you can slide this back even if you need to. Slide this forward if you need to. While you've got two hands, go ahead and open your catheter. It should be perforated here somewhere. There it is. Be very cognizant of where your catheter is. It's really easy for them, this thin rubber, to flop around on you if you're not careful. It's better to miss your garbage bag than to mess around with it and get your hands dirty. This is your lubricant. can't seem to get up. Stick your ends of your catheter on into your lubricant, because all this is sterile, don't forget. And open these. I've never been more proud of my opening ability than I am right now. These are why this bag is so important, because this will stain. I'm going to go ahead and take my swabs out. Put them there. It's all sterile, right? This is my saline that's going to be blowing up the balloon. Once we get the Foley in, and we're going to attach this right here. Make it easier than doing it with one hand. All right. Now we're going to spread the labia. We're going to use our non-dominant hand to spread the labia. And when I say spread the labia, I mean you've got to spread the labia. Whoops, can't use that hand. And it's hard to tell on these mannequins because they're not exactly like the human body. But a lot of students, when they practice, they want to just barely spread the labia, and when they go to clean, they're cleaning the outside of it. You got to spread the labia because your goal is that hole in the middle. Okay? So this hand is now dirty. So we're going to clean, not out here. We're going to clean on down in here, and we're going to go cleanest to dirtiest. And this is where people get confused about, it's the opposite of wounds, because the dirtiest part's going to be the part where the pee comes out. So you're going to clean the far side, pitch it. You're going to clean the near side, pitch it, and then you're going to clean down the middle. And since this is a female, if you watch very carefully, when you clean down the middle, you might see what we call a wink, where the betadine goes in and out of the urethra. And that's a good sign. I mean, it's not a good sign. It just tells you where the urethra is. Because like I said, it's not always that easy. It's not always this easy to find on a woman. All right, so we know where we're going. We're clean. 1 to 2 inches lubrication. Try to get that package off of there again. Coil this around, because like I said, it's like a sneaky snake. And we're going to advance into the urethra. Can you bear down just a little bit as I push this in? It might feel a little bit of pressure, a little bit of burning, okay, Ruth? And you advance your catheter in. There we go. And you're going to go in a female until you see urine. You'll see urine start right here in your tubing, which is great. Once the urine starts, you go on another couple inches. Then you can hold this with your dirty hand. Blow up your balloon. Your balloon should blow up easily. Now, if you don't take this off, that saline's going to come right back out. So now, tug on it to make sure it's in the bladder, because you'll have that couple inches left, and then push it back up in there a little bit so it's not resting right on the neck of the bladder. Okay? Now you can take your sterile gloves off. Wash your hands again. Put on some clean gloves. What I didn't get was a catheter strap. And this can come off. This can come out. If you have more soap and water close by, you can do some more Pericare, but you can use this if it's not too dirty. You're going to attach this to her leg, right here. Like I said, forgot to bring the strap. Usually the straps come with the kits. And this will go on the non-movable part of the bed with this clip. And one thing I did forget to say, I apologize, before you ever do any of it, you want to make sure this is closed. If not, your urine's going to go out on the floor. This gets coiled on the bed. This, of course, is already attached to her leg. And reposition her for comfort. Get rid of all your garbage. You okay, Ruth? That wasn't too bad, was it? And lower bed. And then, of course, you're going to document. Things you're going to document are what size catheter you put in. That's where this is important. It's going to tell you on here. 16 French. We're going to say yes, 16 French is what you put in. It's also going to tell you on this package how much normal saline is used to fill up the balloon. Also, it's going to tell you on your tubing right here how much saline is used to inflate the balloon. You're going to document what kind of urine output you had, how much, what it looked like, what color, did it have anything floating in it, basically. And you're going to document how she tolerated it. And that's all I can think of. I'm sure I've forgotten something.